Let's talk about the call of the week. Nothing can replace a face-to-face consultation with your doctor. That's always first prize, but it's not a privilege everyone has access to. Your next best option is to get advice from a doctor over the phone, which is what Hello Doctor does. Although a doctor wouldn't diagnose over the phone, you'd be amazed at how much you can figure out just by listening carefully and asking the right questions. It's like detective work, like CSI, not so, Cete?
Or like Sherlock Holmes.
Oh, what's...
We get a lot of calls about coughing, sneezing and wheezing, but this one was really interesting. A young woman called up and started talking through her symptoms. Let's call her Lucy. She was 25 and considered herself to be in good health. Her problem was that she'd just taken up mountain biking.
Oh, it's not a problem to take up mountain biking.
She couldn't seem to cycle for longer than 20 minutes without having to stop. She said her chest starts to sound like a busy train station, and that she felt she just couldn't gulp in enough air with each breath.
Sounds like my chest when I'm chasing with my kids or chasing my kids on their bikes. Now, wheezing during exercise could be caused by a whole bunch of conditions. Some of the more common ones include flu, colds or bronchitis. You've got emphysema, you've got reflux, you've got an allergic reaction, there's asthma, exercise-induced asthma, there's smoking, and even heart failure.
Phew, that's quite a list. We discussed her exercising with a cold or a flu, and she told me that she knew all about the throat rule. If her symptoms are above her throat, like a head cold, she was okay to keep exercising. But anything below her throat, like a cough or a fever, she would give her body a few days off. She said she hadn't had a cold or a flu for a few weeks, although she did battle a bit during winter, but we all do.
Yeah, we all do. So you could exclude any viruses contributing to her wheezing. But something like emphysema could be around for a while without showing any symptoms. Fortunately, in this case, emphysema is usually only seen in much older patients who've been exposed to many years of cigarette or secondhand smoke or even air pollution. So I would cross that one off the list.
She assured me that besides the odd cigarette that she dabbled with when she was in university, she was a dedicated non-smoker and maintained a smoke-free home, car and office space. I had to give her a noddy badge.
Good for Lucy.
After all, it's possibly the single best thing you can do for your health.
You're so right. Couldn't agree with you more. Good for you, Lucy. So having ruled out a few conditions, we're left with the following. So allergic reaction, reflux, asthma, exercise-induced asthma, and heart failure.
She told me that she didn't have any problems with blood pressure or diabetes, and have both of them checked regularly as part of a medical aid screening option.
Sounds like a great patient. Wow.
She is. She also confirmed that she didn't have any heart problems she was aware of, and when asked about a family history of heart disease, there weren't any other obvious symptoms pointing towards heart failure.
Okay, so 1 down, 4 to go. I mean, there's allergic reaction now, there's reflux, there's asthma, and there's exercise-induced asthma.
Whew. Allergic reactions often result in runny noses, tight chests, and wheezing, and come on suddenly when you're exposed to something that your immune system doesn't like.
And that's important, that it's sudden, not gradual. That's caused by your flus and colds, etc.
Exactly. She said that she tended to stick to the same route each time she went out, which meant if her wheezing was caused by an allergy, it could be a specific plant or grass type alongside the road.
An insect bite or sting could also result in a tightening of your chest, especially if it were a critter that you're allergic to. But in a case like that, you would need to see a doctor as soon as possible to make sure you keep your airways open. However, if you've ever been stung by an insect, I'm pretty sure you'd remember it, especially if it happened each time you got on your bike. The allergy, however, remains a strong contender.
I'm not sure about that, Michael. It would be, although when I asked her about whether she had the same problems climbing upstairs, she said that she did. So unless you're allergic to, say, a Christmas tree, it's unlikely for there to be too many tree or grass allergens indoors.
Inside, yeah. I don't know anyone allergic to Christmas either. So since her symptoms were specific to exercise, in my opinion, you could also exclude reflux, which tends to surface more while eating and obviously lying down. So that leaves us with asthma and specifically exercise-induced asthma.
True. All the signs seem to point to exercise-induced asthma. So I advise her to see either her GP or a pulmonologist. You know what that is?
A lung doctor.
Exactly. Even though she didn't suffer from asthma on a day-to-day basis, it's still possible to experience asthma brought on by exercise. So off to her doctor she went, who after doing some basic spirometer tests, and making her run up and down 50 flights of stairs gave her a bronchodilator inhaler.
Such an overdramatic individual. Having exercise-induced asthma, in fact, doesn't mean you have to stop exercising. Au contraire, exercise-induced asthma can be easily controlled by using a simple inhaler just before you train.
I'm happy to report that that is exactly what she has been doing. To her amazement, she even whizzed past her husband in her ride yesterday.
To her amazement, to her husband's amazement. Good for you, Lucy, and I think Cete, that's pretty much case closed.